I wanted to ask you a question about training, actually. We can go on to what else can be done within organizations. That'll be the second phase of this. But if we look at employees today, they're scared to express how they're feeling with their managers. Am I going to be put on a performance review? Am I going to be fired for telling my manager how I'm feeling? Now, this is not an issue in one company. This is an issue across the UK. And this is probably one of the reasons why the UK and other countries are impacted so heavily economically, by mental health. Because they can't express their opinions and they don't get the right level of support, they end up taking days off, or they're not efficient. Now, do you feel that managers, I think the stat actually, Claude, is about 11% of managers in the UK have actually had training on mental health. Now, you're great at this because you're very much a people's person and you manage your employees fantastically well. But do you feel like training should be implemented across all organizations? And you can answer no if you think it's, if you don't agree with it.
Well, luckily I do. I think there are two topics I'd like to raise on this. I think, firstly, to answer your question, should training? Absolutely. We're trained what to do in a fire drill, and everyone has their fire exit training on first day, and you have that coordinator within there. Training on mental health and the well-being of staff is paramount. And there are businesses, as you said, like in general, who perhaps don't invest enough in that, and that then creates that stigma. And also, I think it's in a fairness of trying to empower the leaders and give them the resources to know what to do in situations, because it's a responsibility when you become a leader in such things. And being able to feel well equipped is not just about the individual going through the problem stepping forward, but it's also the leader knowing how to support that, what resources are available, how they can manage or coach that individual, what their responsibility of duty of care is, and things like that. So yes, training is hugely important. And then I think you registered another point about managers in general. And I can't help but think about the boss versus a leader kind of thing. I know we've discussed it before, but a leader is someone who talks about we, extends a hand, really grooms and nurtures and creates that environment where that boss is commanding, not really extending a hand, dictatorial, stuff like that. And that's where I think you've really got to strive in those future CEOs picking their future leaders and making decisions on who to promote. Don't just worry about the performance, but look at the character of the individual as well, and seeing if they are inspiring and caring and people orientated, because that's what instills good cultures and ways of working for an environment for people to feel comfortable as well.
I think you do it really well, to be fair. And, we can all do better, but I also do agree that more training is definitely required across, all organizations. You have first aiders, managers should be trained in the same way. So I agree with that. If we look at support now across, an organization, and we kind of look at what organizations currently do. So they'll have well-being coaches, which do a fantastic job. They'll come in and do a session to a sales team, for example, or to a marketing team. Then you have apps around well-being, or you have an EAP solution. The fundamental issue is it's not giving employees support when they need it. Yeah. Now, what do you think, from a managing director's experience, what do you think organizations need? And you don't have to say SupportRoom here, but what do you think they need in terms of providing their employees with the right level of support? And that could just be, managers, training, whatever it is. What's your take on this?
There are two layers to it. So one, I think, yes, management training is key. Secondly, perhaps outsourcing it and having those, because you raise a good point, and you can't tell people not to have that fear, but people not wanting to raise it to colleagues or HR or anyone, people who are associated with the business, and worried that there are repercussions of such actions. So then even having those third party, or some people have it through their work healthcare. A lot of people don't know about that. Typically your healthcare packages of work will have a well-being funding or budget allocation towards that. So I think to summarize what you said, so education and coaching of staff, perhaps I think, so depending on the scale of the organization, outsourcing third-party tools, companies like yourself, not just as that, but like yourself, being able to be available and a resource to perhaps remove that stigma of people not wanting to raise it to members of staff. And then thirdly, as I said, communication, clear availability of resources, whether that's in CRM, that's kickoff workshops, whatever the company may have. Easy access to information is what's important, and confidential as well.
Yeah, of course. And I think the great thing here is that there are two sides to this. There are some organizations that are really just doing the tick box exercise.
Yeah.
And to drive the right level of support, it's not really good enough. But there are some organizations that are doing amazing things for their employees. And if an organization really wants their work, actually take 2 steps backwards. If an organization really wants their workforce to perform well, they need to ensure that their employees are happy. And that is the biggest thing. You know, if we went back 5 years, you know, managers would be cracking the whip. Why haven't you hit your target? Why haven't you done this? But actually, there needs to be a shift. And that shift needs to be about, you know, how are you feeling at work? You know, if you're feeling good at work, you're going to come to work. And if you come to work, you're going to be efficient and you're going to be performing at work. And another thing is now with organizations, they've got to think about retaining staff as well, which is really important in my view. You know, in order to retain staff, they've got to be happy at work. They've got to enjoy their job. They've got to enjoy the way their work-life balance is, for example. So I think in the next year, there's going to be a lot of shift and a lot of changes. And I think, and I don't know if you agree with me here, but a lot of the shift and the changes are not coming from right at the top of organizations. They're actually coming from the employees. You know, I see that across many organizations where, you know, the 18s to 30s, for example, are driving change within the organization, which is amazing to see. And as they drive change, you know, leaders are looking at those changes, thinking, actually, it is making a difference.
I can agree more. I think you touched on a couple points, and it shouldn't be a surprise that the employees or the 18 to 30s and the staff are driving the change. Any good leader would be the first to say, I am not the company, but my team represents the identity which we instill. And so it's right that the individuals and the employees, it shouldn't be a revolution. It's you guys are shaping what this company represents. And then I think the part on performance is spot on. And I think this is what I was saying a bit earlier about performance and mental health come hand in hand. And there may be people sat here listening to this saying, I have a team and I haven't cared for their mental health. And I know he's a top performer. But then I'll say, okay, but then imagine if there were issues, and imagine if you did challenge yourself to support that. There's another 10, 20, 30% in performance that could happen in that person. A happy member of staff is always going to be a better performing one. It happens in them internally being inspiring or externally when they're representing your company. So I think that's huge, like to really understand that it comes hand in hand, both performance and mental health, and recognizing the importance. And the important one of that is mental health, not performance. And I think that emphasis is really what the differentiator should be. A good performance is a consequence of the investment of in your staff.